Let me tell you, nursing school is hard. It was the most difficult time of my life. And even after nursing school, I believe the time from finishing nursing school to passing NCLEX was the worst. It was even way more terrible than the nursing school itself. Hey guys, welcome back to my YouTube channel. My name is Ann, and if you haven't already, subscribe and click the notifications button so that each time I post a new video, you'll be the first to know. So nursing is a very interesting career and very lucrative if you know how to play your cards right. But many people have the wrong misconceptions about nursing, which makes getting into nursing and also being a nurse even more difficult if it's not your true passion. If you don't understand what it's like to be a nurse, if you've never shadowed someone, if you don't have someone close to you who can be really real, like really real and honest about nursing and what they go through on a day-to-day basis, you have to really take your time and understand what nursing is about before choosing nursing as a career. So there are some questions that I feel like you should ask yourself before choosing nursing as a career. The first question you should ask yourself is, why do I want to be a nurse? I'm going to be honest. First things first, if you are coming into nursing because of the money, don't. It is not worth the money. And a quick disclaimer, nurses are not rich. The bulk of money that nurses make is from serious overtime. I have not met one nurse who is experienced who has only one job. To really enjoy your career as a nurse, you really have to have passion for people. You have to be empathetic, you have to be ready to advocate, you have to show some TLC, tender love and care. You have to be ready to surrender everything, like literally everything, to be there for the patient. And not only the patient, their family members, their friends, anyone who is involved in their care. If you do not love taking care of people, and I'm talking about genuinely taking care of people who are sick, people who are in their worst state of their life, and they might not treat you the best that they can. So you have to be willing to overlook a lot of things to truly be a good nurse. The second question is, do I really understand what nurses do? As I stated before, many people do not understand what nurses do. A lot of people think that we just follow doctor's orders and pass medications, which is not true. My advice is that if you think you want to be a nurse and you are not really sure what they do, try to see if you can either shadow a nurse if the hospital would allow you, or I would recommend applying for a job as a PCA or nurse assistant. Every facility calls it different. But being a PCA, it really gives you a front and centered look as to what taking care of patients is like. Being a PCA, it really humbles you. I was a PCA when I was in nursing school, and before nursing school I've worked in home health, I've worked in assisted living, I've worked in nursing home, I've worked in Alzheimer's homes. Like, I've worked in so many different places. And to be honest, it is not easy. I do not know how people stay in PCA roles for years, and I commend them, and they do not get paid what they deserve. But if you can be a PCA, and a good one at that, trust me, you can be a nurse. The next question is, am I committed to be a lifelong learner? Nursing is always evolving. It's always changing. We're always getting different articles. There's different research, different types of practices, different types of materials, different types of procedures being done for different types of patients, per the demographic, per the race, per the disease process. There's always something different, and it doesn't matter whether you work in L&D, ICU. Say you stay in one department for a course of 20 years. I guarantee you will learn so much, and you will definitely have stories to tell. When I talk to nurses that have been nurses since 1975, okay, maybe I'm exaggerating, but like 1980s and up, A lot of them would tell you about their experience from back in the day and how it's very different now. And some of them have been in the same department from that many years ago to now, and they've had to adapt to change. One big change for them was documenting on paper to electronic charting. And we all know that's a big change for people in that generation. But just know that as the years go by, there's different types of diseases. Back then, people who were 30, it wasn't that many of them getting cancer. It wasn't that many of them having heart failure. Now, disease has no age. It's no more someone who's like 80 years old or 90 years old who's having cancer and all these different things. It's people who are really young. So be committed to learning. Next question is, am I a team player? I believe a lot of nurses struggle with this, especially with nursing and nursing assistant relationships. There are many nurses who feel like they're too good to do the job of a PCA, like clean a patient when they have a bowel movement. And that creates a lot of friction because, to be honest, PCAs have so many patients and their job is very hard. So you cannot sit there and leave everything to them. You have to be a team player. You have to help out. If you're in a patient's room and you're giving meds and the patient says, hey, I need to use the restroom, you should be able to take them to the restroom. Instead of going to look for the PCA for 20 minutes, you could have used half that time to take the patient to the restroom. And plus, when you're not a team player, it creates a huge friction in the workplace. Helping each other actually increases patient satisfaction scores. So if you know that you cannot be helpful, you should kind of rethink nursing. The next question is, am I committed to my academics? Let me tell you, nursing school is hard. It was the most difficult time of my life. And even after nursing school, I believe the time from finishing nursing school to passing NCLEX was the worst. It was even way more terrible than the nursing school itself. You have to be on top of your studies. You cannot just wing it and go take an exam. Yes, we all know those people who they literally sit in lecture, download all the information, and when they go take the exam, they get an A. But trust me, even the smartest people, even the people who are very, very intelligent, book smart, they can testify that there were some classes in nursing school that they had to think twice. So don't fool yourself and think that you can start nursing school and play games. You need to really, really commit to studying and studying on a daily basis because there's so much information. Even if you study every day, you're not going to retain all of that information for NCLEX and even for the job. That's why nursing is lifelong learning, because you're not going to remember everything. So knowing that, okay, I'm in nursing school, I'm going to sacrifice things like going out with friends, talking on the phone for long hours and whatnot to my studies, that's really, really beneficial. And sometimes even cutting down work hours too. There are people that I do know that worked full time, but it made it even more difficult for them. The last question is, am I a people person and am I resilient? With nursing, you work with so many people. It's not just you, the doctor, and the patient. It is you, the nurse, the doctor, the patient, the physical therapist, the respiratory therapist, occupational therapist, the social worker, and or the case manager, the family, and not to mention not only regular family, but family who have medical knowledge, who are probably nurses and doctors as well, patients, neighbors, and friends. So you're literally being hit from so many different areas. And I'm talking from the hospital aspect. But even at that, even if it's not the hospital, I know home health, you also deal with physical therapists, you also deal with the social worker, well, the case manager. I know majority of home health has case managers. And you also deal with the doctor, you also deal with the PCAs, the nurse assistant. So it's not only you and the patient. Therefore, you have to be very integral, you have to be very honest with dealing with other people. And resilience. So what does resilience mean? To me, being resilient means to push through any type of obstacle. And with nursing, there are a lot of obstacles. Sometimes the doctor might order for you to do something and you might not agree. because you know the patient more, or maybe you just feel like from your nursing judgment that this is not the correct thing to do. You have to be able to advocate for the patient. Or maybe the patient might not want a specific medication, or maybe they might not want surgery, or whatever it is. They might be just declining that specific care, and you have to advocate. And a lot of times you can get pushback from the doctor. You can get pushback from other interdisciplinary members as well. So being resilient and standing your ground in certain situations, it really helps as a nurse. And it also helps you to gain trust with the patient because they know you have their back. So that's the end of my questions that I feel as though you should ask yourself before choosing nursing as a career. As I stated before, if you are truly interested in nursing, please try to find a way where you can get face-to-face patient interaction, where you are able to care for your patients, like a nurse assistant, a PCA, whatever the facility calls it. And it doesn't have to be a hospital. It can be a nursing home, it can be an assisted living, it can be a skilled rehab. Wherever you can get that experience to give you a better picture as to if this is for you, try it. Thank you so much for watching this video. If you have any questions or even things to chime in, please comment below. Your comments, your opinions are always welcome. And if you haven't already, subscribe and click the notification button so that every time I post a new video, you can get the notification first. Bye!